Hello, my name is Ann Peters and I'm a research coordinator in the Mental Health Nursing Research Alliance. Today I'm going to talk to you about two of our projects related to homeless prevention and mental health. The first is entitled Preventing Discharge to No Fixed Address Youth, or NFAYH2I, and the second is entitled Collaboration to Address Homelessness, Health, Housing and Income, or H2I. Both of these projects involve the participation and support of various community partners. These include Youth Opportunities Unlimited, the Canadian Mental Health Association Elgin Middlesex Branch, Salvation Army Centre of Hope Housing Stability Bank, and the City of London. The projects also involve the support and participation from London Health Sciences Centre, Victoria Hospital, and St. Joseph's Healthcare London, Parkwood Institute Mental Health. The No Fixed Address Youth Project builds upon previous work preventing hospital discharge into homelessness for adults. In this version, housing and financial resources for youth ages 16 to 24 are provided for those who are admitted to inpatient psychiatric wards at LHSC, Victoria Hospital, or Parkwood Institute Mental Health Building. A community liaison from YOU will provide on-site assistance with housing, financial, and related needs. Youth ages 16 to 24 at risk of becoming homeless upon discharge will be able to access the services by drop-in, appointment, or referral. At-risk youth will be connected to supports as needed, including Salvation Army's Housing Stability Bank to assist them with first and last month's rent loans, rental arrears or utility arrears, Ontario Works and ODSP, and connections with housing, including the new YOU shelter designated specifically for youth. Posters and brochures advertising the service will be distributed in the hospitals, and there will be a virtual launch event happening in the community in January 2021. Our research team at Lawson Health Research Institute is evaluating the No Fixed Address Youth Program, funded by the National Centers of Excellence Making the Shift Youth Social Innovation Lab. This project evaluation will last 3 to 4 years. We aim to collect data from 93 youth participants, and we will be following them at 3 time points: baseline or in hospital, and 6 and 12 months post-discharge. Focus groups with youth participants, healthcare providers, and community agency partners will occur at 3 time points during the study. It is important to note that participation in the study is not a condition of receiving the service. That is, any youth in need of housing or financial assistance is able to access it without participating in the research. Our other study addressing prevention of discharge to homelessness is entitled Collaboration to Address Homelessness, Health, Housing and Income, or H2I. This research project is funded by Canada Mortgage and Housing Corporation, or CMHC's National Housing Strategy. This program evaluates the City of London's Coordinated Access Outreach Program in place at LHSC Victoria Hospital and Parkwood Institute Mental Health Care. The City of London has provided a coordinated access outreach worker who will support individuals at risk of homelessness to maintain or obtain housing. Ontario Works will be involved with the provision of income and employment supports for people in financial need, including the provision of funds to cover costs associated with housing. The Salvation Army's Housing Stability Bank may also be utilized to assist individuals to access much-needed financial resources to secure or maintain housing. This evaluation is a 2-year project, and we hope to enlist 115 participants who will be interviewed at baseline while in hospital and at 6 months post-discharge. We're initially evaluating the program in psychiatric wards, but we may expand to medical wards. Focus groups with participants, healthcare providers, and community partners will occur at the beginning and the end of the study. Just like the NFAYH2I project, participation in the study is not a condition of receiving the service. That is, any individual adult at risk of homelessness or in need of financial support is able to access the service while in hospital without participating in the research. The No Fixed Address Youth project team includes members from Lawson Health Research Institute, the Department of Child and Adolescent Psychiatry at Western University, as well as members from the Canadian Mental Health Association Elgin Middlesex, City of London, and Youth Opportunities Unlimited. Our project team also includes members from Ontario Works, the Salvation Army Centre of Hope Housing Stability Bank, as well as members of leadership from LHSE and St. Joseph's Healthcare. We also have participation on our advisory committee from Youth with Lived Experience, as well as membership from Children's Aid Society, Middlesex. The H2I project team includes members from Lawson Health Research Institute, St. Joseph's Healthcare London, London Health Sciences Centre, and Western University. This project also has the support and participation of members of the City of London, Homelessness Prevention Team, Ontario Works, Salvation Army Centre of Hope, as well as the Canadian Mental Health Association Elgin Middlesex. The context behind these research projects is important and bears mentioning. Hospital discharge is a critical period. Discharge into homelessness occurs all too often. According to shelter data, discharges from psychiatric facilities to no fixed address occurred 194 times in London, Ontario in 2002. It's only very recently that researchers have started to address this problem. So why are so many people discharged into homelessness? There are many factors at play, including system issues, individual issues, issues at the hospital and shelter. Systemic issues include the shortage of affordable housing, lack of access to adequate funding, and also a short length of hospital stay so that individuals who need housing assistance are unable to receive it prior to their discharge. Individual issues include lack of adequate income, inability or difficulties in managing a home, issues with their housing history, and substance use disorder. There are no easy fixes. In a literature review, Forchuk et al. 2008 found stable housing post-discharge was consistently associated with positive benefits, including reduced instances of substance abuse, lower rates of hospital use, higher quality of life. Housing and financial supports largely remain separate from the healthcare system. Finding appropriate housing or avoiding a potential eviction takes time. It's very important to start as soon as possible during the discharge process for adults and youth. It is our hope that through these projects, NFAYH and H2I, we can address the health and housing needs of adults and youth at risk of homelessness by streamlining housing and income support into a coordinated system of care. Through this model, a housing-first approach is utilized, which honors housing as a basic human right in order to break the revolving door between hospitals and homelessness. Thank you.